Hello guys and welcome back to our channel CMS Prep. Today in this video we are going to discuss all the questions related to healthcare of community from 2009 till 2024. We have about 13 questions, so let us begin. The difference between type A and type B subcenter as per Indian Public Health Standard is in terms of. The correct answer is labor room or delivery facility. Why? Type B subcenter are upgraded version of type A that have labor room facilities for delivery, while type A does not have labor room or delivery room. Okay, and staffing pattern is same as per IPHS. Location, both can be in rural areas. Location does not define the type. Availability of drugs, drug availability is based on essential services, not based on type A or type B. Hence the correct option is A. Health functionary at PHC level is. So Asha works at community or village level. It is incorrect. Anganwadi worker is working under ICDS scheme and works at village level. Health worker works at sub-center. So the correct option is health assistant. See, health worker works at sub-center, health assistant works at PHC, and health supervisor works at CHC. So the health functionary at PHC level is health assistant. The following are principle of primary health care except intersectoral coordination. Yes, it is correct. Coordination with other sectors is required like education, sanitation, etc. Appropriate technology. Yes, it is also correct. Using low cost suitable technology like standpipes, ORS, etc. Equitable distribution of healthcare. Healthcare for all, not just for rich. So the correct option or the odd one out is B. Provision of specialist at primary health center. PHC is for basic care. Specialists are posted at CHC or first referral unit. And it is not a core principle of primary health care. So the correct option is B. The following are objectives of Indian Public Health Standard for primary health care centers except provision of comprehensive primary health care. Yes, it is correct. Achievement of an acceptable quality of health care. Yes, it is also correct. We have to maintain minimum quality standards. Option D, making services more responsive to the needs of the community. Yes, the services should be community friendly. Odd one out is C. Why? Provision of accident and emergency care. Emergency care is for higher level services like CHC, district hospital or medical colleges, not available at PHC. So the correct option is C. Which one of the following is included in Indian Public Health Standard for a primary health care center? Manual removal of placenta. Yes, it is correct. Basic emergency obstetric care like manual removal of placenta is included at PHC level. Blood storage facility is generally at CHC or first referral unit. Hydrocele surgery is not done at PHC. It is done either at a community health center or district hospital or medical colleges. Safe abortion services is also done at higher centers like CHC or district hospital, etc. Not done at PHC. So the correct option is manual removal of placenta. Consider the following staff: medical officer, pharmacist, anesthetist and health educator. Of them who are routinely posted at PHC. So anesthetist is the odd one out. He or she is posted at higher centers like community healthcare center or district hospital or medical colleges, not at PHC. So medical officer, pharmacist and health educator are routinely posted at PHC. So the correct option is 1, 2 and 4. A village X has a population of 5,000 with a birth rate of 25 per thousand. In any given month, how many pregnancies should be registered with the ANM of this village? So the population of the village is 5,000 and the birth rate is 25 per thousand. So by this formula we get 125 live births will be there. This is the first step. Now in the second step we will calculate the total number of pregnancy. So for that we have to add 10% of the live birth. Why? Because this is the pregnancy wastage factor. Okay, so 10% of 125 is 12.5 and it comes out to be approximately 137.5 and we will take it as 138. So 138 pregnancies were there. Now we have to calculate how many pregnancies will be registered in the ANM. So the concept behind this is that the pregnancy gets registered at 3rd month and the delivery occurs at the 9th month. So any female is registered for only 6 months of the year. Okay, so at any given time we will have 138 divided by 2, that is 69 pregnancies. So the correct answer is D, 69. This is a bit tricky question, but I have explained you how to get to it. Okay, you have to add 10% as pregnancy wastage factor to the live birth. Which of the following are healthcare delivery indicators? Population per trained birth assistant, yes, it is correct. Population per health or subcenter, yes, this is also an indicator of healthcare delivery. Doctor nurse ratio, yes, it is also correct. So all of these are basically indicators of how well the healthcare system is functioning. So the correct option is 1, 2 and 3. Consider the following statement with regard to selection of accredited social health activist or ASHA under NRHM, that is National Rural Health Mission. ASHA must be a woman, preferably in the age group of 18 to 25. It is incorrect. She can be between 25 to 45 years. ASHA must have formal education up to class 10. This is also incorrect because the minimum education is up to class 8th, not up to class 10th. ASHA must be a resident of the village. Yes, it is correct. ASHA may be married, widow or a divorced woman. It is also correct. So ASHA is basically appointed by the village panchayat. She is the first link between ANM and the village population. She is trained by the ANM and Anganwadi workers. Okay, and the duration of training is about 23 days. So the correct option is 3 and 4. Specialists that should be available at community health center include. So at CHC level there are basically 9 specialists that are required. They are as follows: pediatrics, gynae, medicine, surgery, an ophthalmologist, anesthetist, a dental officer, Ayush officer. Along with that, a public health program manager is required. The total staff is about 46 to 52 people. A health supervisor is also posted at CHC level. So pediatrics, ops gynae and surgery specialist are available at CHC, and derma is the odd one out here. It is not mandated under CHC under the IPHS norms. So the correct answer is 1, 2 and 4. Which of the following correctly represents the 3 critical determinants of a healthy facility being declared as a first referral unit? Availability of emergency obstetric surgical interventions. Yes, it is required to declare as a first referral unit. Availability of immunization services. No, it is routine services provided under even lower facilities like PHC and subcenter. Blood storage facility. Yes, it is required. And newborn care. Yes, it is required. So out of these 4 options, 1, 3 and 4 are required to declare a facility as first referral unit. Okay, so the correct option is B. Which of the following key actions area are incorporated in the Ottawa Charter? Building healthy public policy. Yes, healthy policy is included in the key action area. Strengthening community action for health. Yes, this is also included. Reorienting health services. Health system reorientation is also a key action area under the Ottawa Charter. So the correct option is 1, 2 and 3. It is a fact-based question. You don't need to take too much stress about these types of questions. These are bouncer questions which come about once in 5 to 10 years. Okay, so keep your concepts strong and these questions will just come and go. The example of deprofessionalization of medicine is widely seen in India in form of: see, when professionals act unethically, it damages the trust and standard, and this is known as deprofessionalization. So the correct option is D. Medical malpractice by doctor is a form of deprofessionalization. Rural internship by doctor is educational. Providing primary health care is a part of doctor's job, or it is the professional work of a doctor. Irrational use of antibiotics by doctor is bad but not always a structural breakdown. Okay, so option D is the most correct one out here, and this is the correct option. So guys, with this we have covered all the 13 questions related to healthcare of community asked in UPSC CMS from 2009 till 2024. I hope you guys liked it. If you liked it, kindly subscribe to our channel, comment, share and follow. If you want to attempt the live quiz or want the PDF of this chapter, subscribe to our Telegram channel which is mentioned in the description. Meet you guys in the next video. Thank you.